You may be doing everything right. You take the pills the doctor prescribed. You cut back on the salt. You switch to the low-sodium bread even though it tastes like cardboard. You go for your walk almost every morning, even on the days your knees would rather not. And still, the numbers on that little blood pressure cuff refuse to behave. Some mornings they're fine. Other mornings they're higher than they were a year ago. And you sit there in the kitchen, cuff still on your arm, wondering what on earth you're doing wrong. Here's what almost no one tells you. There is something on your bed, something you touch every single night, something you've probably owned for years without ever thinking twice about it. And for a lot of people over 60, it's quietly working against every effort they're making. It's the pillow under your head. Now, before you roll your eyes and say, come on, it's just a pillow, stay with me for 1 minute. Because sleep researchers, cardiologists, and sleep apnea specialists have all been circling the same quiet finding for years. The pillow you sleep on affects 3 things that directly control your blood pressure while you're asleep. It affects the angle of your neck, which affects your airway. It affects how deeply and how consistently you breathe through the night. And if it's more than a couple of years old, it affects the amount of inflammation your body is dealing with in the background, every single night. Most people assume their blood pressure just sits there quietly while they sleep. It doesn't. Your blood pressure moves all night long. It's supposed to drop. It's supposed to rest. And in a lot of older adults, it isn't dropping the way it should. Something keeps nudging it back up in the small hours of the morning. Something keeps triggering little stress responses at 2, 3, 4 a.m., long before the alarm goes off. And when doctors go looking for the reason, they check the medication, they check the diet, they check the walking routine. What they almost never check is the pillow. Think about it for a second. When was the last time you replaced yours? 2 years ago? 5? 10? A lot of folks over 60 are still sleeping on the same pillow they bought back when gas was under $3 a gallon. It's flattened in the middle. It has a faint yellow ring you pretend not to see when you change the pillowcase. It doesn't spring back the way it used to. And every night, for 7 or 8 hours, your head, your neck, your airway, and your nervous system are all reacting to it. This isn't about panic. It's about paying attention to something you've probably never been told to pay attention to. Because if your morning numbers keep climbing, and no one can quite explain why, the answer may not be in your medicine cabinet. It may be sitting right there on your bed. And to understand why a pillow could possibly matter this much, you first have to understand something most people were never taught. What actually happens to your blood pressure while you sleep? Here's something almost nobody explains in a normal doctor's visit. Your blood pressure isn't one steady number. It moves. It rises and falls in a rhythm, all day and all night. And that rhythm matters more than most people ever realize. During the day, it goes up when you climb the stairs, when you argue with the cable company, when you drink your second cup of coffee. That's normal. But at night, something very specific is supposed to happen. When you fall into deep sleep, your blood pressure is supposed to drop 10%, 15%, sometimes even 20% lower than your daytime numbers. Cardiologists call this the nighttime dip. And that dip is not a small detail. It's one of the most important things your heart and your arteries do all day. It's the window where your blood vessels get to rest, repair, and cool off after all the pressure they've handled since morning. Here's the part that should get your attention. In a lot of adults over 60, that nighttime dip doesn't happen anymore. The numbers stay high through the night, or worse, they climb. And when doctors see that pattern on a 24-hour monitor, they get concerned. Because people who don't dip at night have a significantly higher risk of stroke, heart attack, and kidney trouble, even if their daytime readings look reasonable. The daytime cuff can lie. The nighttime pattern rarely does. Then there's the other piece of the puzzle. Somewhere between 3 and 6 in the morning, your body starts preparing to wake up. Cortisol rises. Adrenaline gently ticks upward. Blood pressure climbs. In a healthy person, it's a smooth, gentle ramp. But in millions of older adults, it's not gentle at all. It's a spike. Sharp. Sudden. Sometimes 50 points in an hour. Doctors call it the morning surge. And it's the single most dangerous window of the entire day. More heart attacks happen between 6 and 10 a.m. than at any other time. More strokes, more sudden cardiac events. That window is not random. It's biology. Now here's where the pillow quietly enters the picture. Anything that disturbs your breathing at night, even a little, interrupts the dip. Anything that irritates your airway causes tiny stress responses. Anything that makes your body work harder to get oxygen keeps your nervous system on low alert instead of letting it settle into rest. And the position of your head, the tilt of your neck, the angle of your airway, controls a huge amount of that. Add in the dust, the allergens, the microscopic irritants inside an aging pillow, and you've got a nightly situation that keeps nudging your blood pressure back up, over and over, hour after hour. while you have absolutely no idea it's happening. That's why so many seniors wake up with a headache they can't explain. That's why so many feel groggy, foggy, and strangely tense in the first hour of the morning. It's not just old age, it's a nervous system that never got to fully rest. It's a set of arteries that never got their overnight break. And of all the things that can quietly steal that break from you, the very first one, the one sitting inches from your face right now, is the angle your neck is bent in for 7 hours straight. Take a moment right now and picture how you sleep. Not how you fall asleep, how you actually spend most of the night. Your head is resting on that pillow at some angle. Maybe your chin is tipped down toward your chest. Maybe your head is pushed up so high your neck almost forms a little hill. Maybe the pillow has flattened so much over the years that your head is barely lifted off the mattress at all. Whatever position it is, your airway is being shaped by it. All night, every night. Here's the piece most people never hear. Your airway, the tube that carries air from your nose and mouth down into your lungs, is soft. It's not a rigid pipe. It's tissue, and tissue bends. When your pillow is too high, your chin gets pushed toward your chest, and that little bend at the front of your neck partly folds the airway shut. When your pillow is too flat, your head tips back and the tongue and soft palate drift toward the back of your throat, narrowing the passage from the other direction. Either way, the air has to work harder to get through. And when air has to work harder, so does your heart. You may not wake up gasping. You may not even snore loud enough for anyone to notice, but your body notices. Every time the oxygen level dips even slightly, your brain sends out a tiny alarm. Not big enough to fully wake you, just big enough to pull you out of deep sleep for a few seconds. Doctors call these micro-arousals. You'll have no memory of them in the morning, but your nervous system remembers. Cortisol jumps, adrenaline nudges up, blood pressure climbs, and the nighttime dip you were supposed to get? It gets shorter and shallower every time this happens. Now imagine that pattern repeating 15, 20, 40 times a night. That's not rare. That's common in adults over 60. And the pillow, the simple, ordinary pillow, is often one of the biggest reasons the airway keeps getting pinched in the first place. Here's a simple sign to pay attention to. Do you ever wake up with a stiff neck that takes an hour to loosen? Do you find yourself rolling your shoulders in the kitchen, trying to get the tension out? Do you wake up with a dull ache at the base of your skull? Those aren't just aches, they're clues. They're telling you that your head spent the night in a position your spine did not enjoy. And if your spine didn't enjoy it, your airway probably didn't either. There's a quick test. Lie down flat on your bed the way you normally sleep. Have someone look at you from the side or take a photo with your phone. Your ear, your shoulder, and your hip should form a mostly straight line. If your chin is jammed toward your chest, the pillow is too tall. If your head is tipped backward and your throat is stretched, the pillow is too flat. Either one is quietly costing you. But neck angle is only half the story. Because even if you fix the height tomorrow, there's something else inside that pillow you probably haven't thought about in years. Let me tell you something most people would rather not hear. A pillow that's more than 2 years old is not just a pillow anymore. It's an ecosystem, and you've been breathing it in every night for however long you've owned it. Here's what actually builds up inside the average older pillow. Dead skin cells. We shed about 1 gram of them every night, and a lot of that lands right where your face rests. Sweat, even in a cool bedroom. Saliva, if you sleep with your mouth open, which most seniors do at some point during the night. Body oils, traces of hair product, face cream, and whatever you touch during the day. And then, feeding on all of it, an enormous invisible population of dust mites. Not 1 or 2. Studies have found tens of thousands of them living inside a single older pillow. You will never see them. But every night, 6 inches from your nose, they're there. Now, here's why this matters for your blood pressure, and this is the part that connects it all. Dust mites, mold spores, and the microscopic debris inside an aging pillow are inflammatory triggers. Your immune system doesn't ignore them. It reacts, quietly, every single night. That reaction shows up as a low, steady hum of inflammation in the body. The kind that never causes a sneeze or a rash, but never really goes away either. And chronic low-grade inflammation is one of the biggest hidden drivers of stiff, aging blood vessels. Stiff blood vessels don't stretch the way they should. They don't relax the way they should. And when blood vessels lose their ability to relax, the pressure inside them rises. It's simple mechanical fact. You may have noticed a stuffy nose in the morning that clears up within an hour. You may have noticed you wake up clearing your throat. You may have a little dry cough on the pillow side of the bed that you don't have anywhere else in the house. These are not small things. They're your body telling you it's dealing with something all night long that it shouldn't have to deal with. And it gets worse with humidity. If your bedroom runs warm, if you live somewhere the summers are muggy, if the air conditioning doesn't quite reach the bedroom, moisture builds up inside the pillow. That's when mold quietly enters the picture. You don't need visible black spots. You just need enough microscopic growth to keep your immune system on alert. For a person already managing high blood pressure, that's one more nightly stressor added to a system that was supposed to be resting. Here's the simple truth. Pillows have a lifespan. Most experts put it at 18 months to 2 years for standard pillows, maybe 3 years for higher quality ones. After that, they're not neutral objects anymore. They're working against you. And if you've been sleeping on the same one since before the pandemic, it's worth taking seriously. But inflammation and irritation are only one piece of what's happening at night, because there's another pattern, one that ties the pillow, the airway, and your blood pressure together into something even more serious. And it's something most seniors have been told is just a normal part of getting older. Here's something that quietly reshapes how doctors think about high blood pressure in older adults. When someone's numbers won't come down, even with 2 or 3 medications, one of the first things a good cardiologist starts suspecting isn't diet. It isn't stress, it's sleep apnea. And most of the seniors who have it don't know they have it. Now, when most people hear sleep apnea, they picture a big man snoring like a freight train, waking up choking in the middle of the night. That's one version. But there's a much quieter version that's incredibly common in adults over 60, and it doesn't look dramatic at all. It looks like light snoring. It looks like waking up at 3 in the morning to use the bathroom, night after night. It looks like a dry mouth in the morning. It looks like feeling tired even after 8 hours in bed. It looks like a spouse gently saying, "You stopped breathing for a second last night." And most people brush all of that off as just getting older. It isn't just getting older, it's a pattern. And here's the direct link. When your airway partly closes during the night, even for 10 or 20 seconds at a time, oxygen drops. When oxygen drops, your body panics. Your heart rate jumps. Your blood vessels clamp down. Your blood pressure spikes. Then you take a breath. Oxygen comes back and your body settles. Then it happens again and again. Some people go through this cycle dozens of times an hour without ever remembering a single one of them. Every one of those cycles is a hammer blow to your cardiovascular system. And over years, it stiffens the arteries and drives up the baseline blood pressure until pills alone can no longer bring it back down. This is where the pillow quietly enters the picture again. Because a lot of mild sleep apnea in older adults is what's called positional, meaning it only happens in certain sleep positions, or only when the head is at certain angles. Change the position, change the angle, and the apnea eases up. Keep sleeping the same way on the same worn-out pillow, and it continues, night after night, year after year. Here's the part I want you to really hear. If your blood pressure has been creeping up over the last few years, and no one has ever asked you about your sleep, really asked, about snoring, about waking up gasping, about morning headaches, about how tired you feel at 10 a.m., then a real piece of the puzzle has been missed. Sleep apnea is one of the most common untreated causes of stubborn high blood pressure in seniors, and it's one of the most treatable once someone actually looks for it. You don't need to panic about this, but you do need to notice it. If your spouse has ever mentioned that you snore, or that you go quiet for a moment and then take a sudden deep breath, write that down. If you wake up more than once a night to use the bathroom, write that down too. Nocturnal bathroom trips in older adults are often not a bladder issue at all. They're an apnea signal. The heart releases a hormone during those oxygen dips that tells the kidneys to make urine. That's why so many seniors are up at 3 a.m. and don't know why. Once you start seeing this pattern, you can't unsee it. And your own body has been leaving you clues every single morning. Your body is honest with you. It just speaks quietly. And the first hour after you wake up is when it's telling you the most about what happened during the night. Most people rush past those signals, coffee, news, phone, breakfast, and never stop to read them. So let's slow down and go through the ones that matter. Because if 2 or 3 of these sound familiar, your pillow may be part of the problem. The first sign is a morning headache. Not the kind you get from staying up too late, but a dull, pressing ache at the temples or the back of the head that shows up almost every morning and eases within an hour of getting up. That pattern is classic. It often points to a night of shallow breathing, oxygen dips, and a blood pressure that didn't dip the way it should have. The second sign is a stiff or sore neck that takes real time to loosen. If your neck is telling you every morning that it spent the night in a bad position, believe it. Your airway was probably bent right along with it. The third sign is a dry mouth. If you wake up with your tongue stuck to the roof of your mouth, that means you were breathing through your mouth for a big part of the night. Mouth breathing while lying down is a huge red flag for airway restriction, and it almost always makes nighttime blood pressure worse. The fourth sign is puffiness in the face, especially around the eyes. Some morning puffiness is normal, but if it's consistent day after day, It can point to fluid shifts caused by disrupted breathing and disrupted circulation overnight. The fifth sign is waking up with a numb or tingling arm. That's often a position and pillow issue. Your shoulder and neck weren't supported, and a nerve got compressed. It sounds minor, but it tells you your alignment was off for hours. The sixth sign is waking up between 3 and 5 in the morning almost every single night. Sometimes with your heart beating a little faster than it should be. That's often the morning surge starting early, driven by exactly the kind of nighttime stress we've been talking about. And the seventh sign, this is the big one, is a morning blood pressure reading that's noticeably higher than your evening reading. If you take your pressure at night and it looks reasonable, and then you take it first thing in the morning and it's 15, 20, 30 points higher, that gap is telling you something important. Your body did not rest the way it was supposed to. Here's what I want you to do. Not tomorrow morning. Before you get out of bed, before the coffee, before the phone, just take 30 seconds and check in with yourself. How does your neck feel? Is your mouth dry? Is there a headache starting? Is your arm asleep? These are not random complaints. They are data. And once you start tracking them, a pattern usually becomes clear within a week. If any of those signs feel a little too familiar, the next question is a fair one. What does a pillow that actually protects your blood pressure look like? Let's get practical, because if the pillow is part of the problem, then the right pillow is part of the solution. And you don't need to spend $300 at a specialty store to get it right. You just need to know what actually matters. Most people have never been told any of this, so pay close attention. These are the details that make the difference. Start with height. This is the single most important thing, and it depends on how you sleep. If you sleep on your side, which most older adults do, your pillow needs to be tall enough to fill the space between your ear and the outside edge of your shoulder. That's usually 4 to 6 inches of loft. Your head should stay level with your spine, not tipped up, not sagging down. If you sleep on your back, you want a lower pillow, usually 3 to 5 inches, just enough to keep your head from tipping backward and stretching your throat open. If you sleep on your stomach, and I say this gently, that position is very hard on the neck and the airway at any age, and even harder after 60. If you can transition to side sleeping, your neck and your blood pressure will both thank you. Next, firmness. You don't want a pillow that flattens the moment your head touches it. You also don't want one so firm it feels like a brick. What you want is medium firmness, something that supports the weight of your head without collapsing, and springs back when you lift your head off it. A quick test at home. Press your hand into the middle of the pillow. If it stays dented, it's done. Time to replace it. Then, material. Memory foam contours nicely and keeps its shape, but it can trap heat, which some seniors find uncomfortable. Latex is supportive and naturally resists dust mites, which is a real advantage. Down and feather pillows feel luxurious, but flatten quickly and often need replacing every year. Buckwheat hulls are old-fashioned, but keep neck alignment beautifully. There's no single perfect answer. There's just the answer that fits your body and your sleep position. Now, the piece almost everyone forgets, replacement timing. A standard pillow should be replaced every 18 to 24 months. High-quality memory foam or latex, maybe every 3 years. If you can't remember when you bought yours, it's already time. That's not marketing. That's just how long it takes for a pillow to accumulate enough moisture, oils, and irritants to start working against you. One more thing. Wash your pillowcase weekly in hot water, and wash the pillow itself, if the label allows, every 3 to 6 months. Use a zippered, allergen-proof pillow protector underneath the pillowcase. That one small step cuts down dust mite exposure dramatically, and for a lot of people, it makes a noticeable difference within a few weeks. None of this is complicated. None of it is expensive. But together, it changes what your body is dealing with for 7 hours a night. And once you've got the right pillow in place, the last piece is how you actually use it. The right pillow is a foundation, but a foundation only works if you build on it correctly. So here are the small nightly habits that support everything we've talked about, and they cost you nothing. Start with position. If you can, sleep on your left side. It sounds like a small detail, but left side sleeping takes pressure off the major vein that returns blood to your heart and tends to ease breathing at the same time. If back sleeping is more comfortable, that's fine, but consider raising the head of your bed slightly, maybe 4 to 6 inches, using a wedge or bed risers. Even that small elevation opens the airway and reduces the number of nighttime pressure spikes for many older adults. Next, the bedroom itself. Keep it cool. Somewhere between 65 and 68 degrees is the sweet spot for deeper sleep and better nighttime dipping. Keep it dark, keep it quiet. And if you can, keep the humidity moderate, because dry air irritates the airway and damp air feeds the dust mites. Then, timing. Try to go to bed and wake up at roughly the same time every day, even on weekends. Your blood pressure rhythm depends on that consistency. Avoid heavy meals within 3 hours of bedtime, because digestion pushes pressure up right when it should be settling down. Ease off caffeine after early afternoon, and be honest with yourself about alcohol. Even one drink close to bedtime disrupts nighttime dipping in a lot of older adults. Finally, track your numbers. Take your blood pressure in the evening and again first thing in the morning for 2 weeks. Write it down. If your morning numbers consistently run higher than your evening numbers, bring that log to your doctor. That's the kind of specific, real-world information a doctor can actually use. And if snoring, bathroom trips, or morning headaches are part of your pattern, ask directly about a sleep study. Don't wait for them to bring it up. Small things, repeated every night, they add up faster than you'd think.